Hi everyone. So today I've come up with something which will help you, guide you, and let you know that when a dental visit is a must. So today I'll be discussing about what type of toothache makes dental visit a must. And since I'm a pedodontist, so I'll specifically be targeting the toothache with regards to children. So, the first question that comes to the mind is what are the types of pain that one can experience? So, to start with, whenever you have mild pain or your child complains of having mild pain or on eating or drinking anything, that should not last for more than few minutes. That means she's taken something or he has taken something, maybe a chips or a bite of cookie or anything. That's what usually toddlers or children thrive on. So whenever they eat something or drink something, they have this sudden mild pain and it goes off after a few minutes. Then the second kind of pain that children usually complain of is they have some moderate kind of pain on eating or drinking anything, and that stays for quite some time. That means they'll have a bite of something or they'll maybe have a sip or lick of ice cream or anything, and they'll say that, Mama, I've got some pain. And you ask them, is it very bad? And they let you know that no, it's not that bad, but it's hurting. Then the third kind of pain that we hear from children is that when they say that I've got severe pain on eating or drinking, and that severe pain does not even go easily and it stays with them for hours. And the fourth kind of pain that comes up is severe spontaneous pain. That means while they are sleeping or any time of the day, will they complain of having sudden pain and that stays for hours together, will not reside till you give them a painkiller. So, in that case, what do these different kind of pain mean? When we understand that what pain means what, then this will next guide you that why is it important to rush to a dentist in what kind of pain. So, the pain type that I just mentioned, that is if you have mild pain or moderate pain on eating or drinking something, that means the tooth decay is still till the dentine. That means it's still in the hard layer of the tooth. That means the tooth can still be saved by just filling. But in case the child complains of severe pain on eating or drinking anything, or spontaneous pain, either while he or she was sleeping or any time during the day, in that case, that is an alarming sign. That means the decay of the tooth has reached the pulp. That means the area of the tooth that has the nerves and the blood supply. And once the infection has reached pulp, then it means that it has moved the stage of being saved by just filling, and it requires a pulpectomy or a root canal therapy, most commonly called as. Then, so obviously, if your child is complaining of a severe or spontaneous pain, please do not delay it by following any kind of home remedies, or do not procrastinate it by just giving them some antibiotics or some painkillers. It might get resolved at that time, but remember that the damage is still going on without letting the child experience pain. The thing with teeth is that the pain can be reduced, but the damage that has already happened needs to be mechanically removed and replaced by some palliative or by some medicinal material, and that is why a visit to a dentist is absolutely necessary. What happens if one still doesn't visit the dentist and ends up by just following some home remedies or taking some painkillers? Then in that case, very sadly, the tooth will not be able to be saved and it will have to be extracted. Because by now, the damage has foregone or surpassed the level of tooth and it has reached the bone. The tooth is highly disintegrated, it cannot be saved, and sadly, but factfully, it will need to be extracted so that the damage is not passed on to the other supporting structures. So please do not delay your dental visit, and specifically if you have the pain type of severe and spontaneous type, please rush to your dentist. Otherwise, ideally, every kind of pain requires an urgent dental visit. But the sad part is in India, a dentist is only visited when the child has pain, although ideally one should visit the dentist following a normal general checkup protocol, that is every 6 months or at least a year. That is at least optimally practicable. That's it. I hope it was helpful, and if you have any doubt you can let me know in the comment section. I'll be more than happy to help. Take care. Thank you.